Very good evening to each and everyone. Warm welcome to Swasthya Ayush Wellness Expo Con 2023. So today's session topic is scientific session on Ayush practices, products and scientific appraisal. Next. So theme of this session is Ayush practices and products, which include Ayurveda, Yoga, Unani, Siddha and Homeopathy, have been the subject of scientific appraisal to evaluate the safety and effectiveness. Many of Ayush products have been studied in rigorous scientific studies, which includes clinical trials, systematic reviews and meta-analysis. Overall scientific appraisals have contributed to a better understanding of the safety and effectiveness of Ayurveda practices and products. Ongoing research in this may contribute to shed light on their potential benefits. Our chair for the session, Dr. Venugopala Tota Garu, to come on to the dais. I request Dr. Sandeep to give him a bouquet. Dr. Venugopala Tota Garu is BMS graduated from Usmania Hyderabad College and MSc Psychology, and he is successfully running a hospital named Chavan Ayurveda Hospital at Hanmakonda since 30 years. Agata Chikitsa with special reference to Yoga Vasti. Sir treated more than 8,000 Pakshagata paralysis patients with Panchkarma therapies. Sir is founder and chairman of TVR Memorial Education Society, Warangal. Sir worked as a president of 2007 to 2009. Worked as a general secretary and organizing secretary in many conferences. Now I call co-chair for the session. Okay. Dr. Ram Gokarappu Garu is MD Ayurveda from Kerala, MSc Psychology, DAS and USA, successfully running Kerala Dhanvantari Ayurveda Vaidyalayam, Hanmakonda since 19 years. Sir received 2 awards from the Government of Telangana, the Best Ayurveda Practitioner Award, August 15th, 2014, and Best Social Work in the field of Ayurveda, January 2014. You hear it, okay? So Dr. Vinaya ma'am is a hardworking naturopathy and yoga physician and a practitioner of music therapy. She is also B high grade vocalist at Niramaya Wellness Center, Hyderabad, and a senior medical officer at VSR Nature Cure Center, Hyderabad. Dr. Vinaya has over 20 years experience in applying therapeutic strategies in both teaching and treating her patients. Being trained in Carnatic classical music, she has performed on various platforms across the length and breadth of India since childhood. She has contributed several articles on talks and seminars on sound therapy. Next. So guidelines for the presenter. Time allotted for keynote speaker is 15 minutes and time allotted for presenter is 10 minutes. First bell, based on assessment criteria, best paper award will be announced at the end of the session. Best paper award presentation award will given in valedictory program. Rest of all presenters will get their certificates at the end of the session. Now I call Dr. Vinay.
There was a village, and one day in the morning, there was a bad smell coming from one of the ponds. And the villagers rushed to one of the advisors and they asked him, "What shall we do? There is a bad smell in the pond." And that person said, some very beautiful scented flowers are there. Go and pour it to the pond and the smell will go. And the smell is gone for a couple of days. The third day, again, the smell is back. Then the wise person said, just check if there is a goat or something fallen into the pond and see if that can be removed, and then you spray whatever the fragrances, the smell will be gone forever. And they did, and they found a dead goat inside the pond. So why I'm telling this story is all Ayush practitioners, our job is to find where is the dead goat in a person when he's coming to you for a disease. See, a person may come to you for various health problems, but the root cause will be somewhere lying in his lifestyle. So try to understand not just the disease, but who is having the disease. So that is what we do in Vengala Sanjeev Reddy Nature Cure Center. I'm very happy here today because we have our chairman sir among us, Mr. Vengala Sanjeev Reddy Garu, who wanted to open a naturopathy center, very different, very unique in its approach in healing various problems in Hyderabad. So that is when this idea of opening this center in 12 acres of beautiful nature, because naturopathy cannot go without nature. So we have chosen the place where there is beautiful landscape naturally. It is not that we have planted those trees. They are there since many, many years. There are beautiful, huge rocks if you come and see our center. So why I'm telling this is, it is his long vision to see naturopathy going in a way healing people. So I am Dr. Vinaya, as he introduced me. I'm a senior medical consultant there, and there are a couple of things I wish to share with you. We do iris diagnosis. That means we look into the iris of the person and see which organ is having the weakness or where the problem actually lies. Suppose somebody comes with back pain, but the iris may show there is some problem in the large intestine. So it could be constipation that is causing the back pain, not as such the back pain due to muscular problem. So we kind of deal with the health issues through the most traditional way to the most modern equipments. Like we have colon hydrotherapy, we have Vichy shower, we have various hydrotherapy equipments. We do mud therapy, color therapy, sun therapy, massages, different forms of massages. We have yoga therapy, we have acupuncture, acupressure, reflexology, we have physiotherapy, we have every possible drugless therapies. That means medicine-free treatments under one roof. We have a couple of doctors with us who is 24 hours available to the patient. It's a residential program because we believe that food is medicine. So when the doctor prescribes pomegranate juice, that is what is being served to the patient, not because he likes pomegranate. So the patient is convinced and counseled every time to make the necessary modification in his lifestyle so that the problems are not just symptomatically relieved, but also when he goes back home, he will learn something. For example, somebody comes with high BP, he'll be taught simple hydrotherapy like ice cube massage on the neck when there is high BP, and within 20 seconds, your BP is back at normal. Okay, so simple procedures are taught. So we all have these simple measures and right lifestyle, which has been forgotten over the period of time, which has been reminded again in VSR Nature Cure Center. So I don't want to take a lot of time, as he was rightly mentioning that there is no much time for each speakers here. And I don't want to be sounding bored, and I don't want to, afternoon sessions are extremely boring, I know. There is one more treatment which is unique in VSR Nature Cure Center, which is music therapy. So instead of speaking about it, if I speak about idlis for 3 days, okay, if I give you idli to eat, within seconds you will understand what is idli. So I want you all to know what is music therapy by undergoing a couple of seconds or a couple of minutes of music therapy right now. So all of you, please sit relaxedly, close your eyes, keep your bags down. And as I'm singing, just try to remember all the emotions that you come across as you are listening to me. I'm not purposefully singing the Pallavi of the song so that after I complete the Charana, those who are aware of this song will recollect which song it is, which is good for your brain. परमयोगी जन भागदेय श्री परम पुरुष परात्परा परमयोगी जन भागदेय श्री परम पुरुष परात्परा परमात्मा परमात्मा श्री तिरुवेंकटगिरि देवा परमात्मा परमाणुरूप श्री तिरुवेंकटगिरि देव शरणु श्रीमन्नारायण 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 नी श्रीपाद में शरणु शरणु. You can open your eyes slowly. Everybody knows that music heals. Music is beyond entertainment. But nobody knows why exactly it feels so good to listen to music. At least for a couple of seconds you forgot where you are, where are you from, who you are, and all that. Why? Because the music works on your chakras. In Ayush system, we believe that there is energy pathways in your body. You call it marmas, you call it chakras, you call it meridians or whatever it may be. So the music, the notes, sa re ga pa da sa sa da ba ga re sa. Sa is on Muladhara chakra, Re is Swadhisthana chakra. So on different chakras. So when I say Parama Yogi Jana Bhaga, it is like you're massaging the chakras. Right? So music can work like a massage to your aura or to your energy body. So these are some of the treatments that we have introduced in our center to make it unique, to make it different, and to make it more holistic in its approach. So whenever a patient or a person, a sadhaka comes to our center, we give overall health to that person. Maybe he comes with some shoulder pain. We don't want to limit him only for the shoulder. We give him whatever best health possible to rest of his life. So having said this, I wish all of you in the same, I'm sure all of you are into the same industry, to the same divine profession of healing people as doctors. I wish all of you great success in your endeavor. And I thank immensely from bottom of my heart to everyone who is responsible for inviting me here today as keynote speaker. I thank Ayush department. I thank the organizers of Swasthya Expo. And hopefully I keep meeting all of you in my journey of life. And you are most welcome to our center, VSR Nature Cure Center, which is in Shamirpet, which is in the Kisara highway, which is very close to Bits Pilani. You are most welcome to drop in anytime, refer your patients if they need any of this kind of psychosomatic approach towards their illness, because I strongly believe that disease is not just limited to the body, but it is also the mind. So we give an overall health promise to the people who are coming. Please refer your patients. Please come down and see how we treat patients, and most welcome to give your valuable suggestions in our journey of health. Thank you very much and have a beautiful evening. Thank you.
session, presentation, scientific relevance of the topic, scientific methodology, and clarity of the presentation, and elements of new knowledge.
Should I start? Good afternoon, one and all. Myself, Dr. Sindhu, PG final year, Department of Panchakarma. Today, my topic of discussion is role of Ayurveda in managing movement disorders. Guided by Dr. M. Praveen Kumar, Associate Professor, and Dr. B. Johar, Head of the Department. Next slide. So coming to the introduction, movement disorders are a clinical entity with either excess or paucity of voluntary and involuntary movements. So these are unassociated with muscle weakness. They are of two types, hyperkinetic and hypokinetic. Hyperkinetic disorders are any involuntary movements like ethetosis, balism, chorea, dystonia, etc. And hypokinetic movements like echinacea, hypokinesia, and bradykinesias. Abnormal movements are the disorders of basal ganglia due to direct and indirect pathway defects. Next. So there was very less description given in Ayurveda regarding the movement disorders. So today our aim is to study the symptomology and treatment methodologies applicable in movement disorders. Also these include new treatment principles that can be applicable. Next slide. So first coming to the first movement disorder, that is Kampavata. So Kampavata has been said as a single entity in various disorders like Nanatmaja Vata Vyadhi or a Visha or a symptom of Vata Prakopa. But Basavaraja has explained in Basavarajiyam that the symptomology of Kampavata as Karapada Tali, Deha Brahmana, Matikshina and Nidra Bhanga. So these can be correlated with Parkinson's disease. It is the second most commonest neurodegenerative disorder due to loss of dopaminergic neurons in the basal ganglia. Next. So next is the Avarna Vatas. So both hyperkinetic and hypokinetic movements have been explained in various symptomology of Avarna Vatas. For example, in Pittavrita Vyana Vata, Gatra Vikshepana and Stamba has been explained. And in Kaphavrita Vyanavata and Udanavata, symptoms like hypokinetic movements like Stamba, Chesta Hani have been explained. Next. Next, Akshepaka. Akshepaka is generally thought to be convulsions, but when we see the definition, it is said to be Muhur Muhur Dehaha, Muhur Sharaha, Muhur Muhur Akshepada, Akshepaka iti Smrutaha. The vigorous movements of the body or body part occurring again and again is said to be Akshepaka. So Akshepaka is called as Apatanaka when the person falls in between. So these Akshepaka can be correlated with hyperkinetic movements. For example, dystonia, it is said to be sustained intermittent muscle contractions causing repetitive abnormal movements or postures. Or chorea, that is jerky movements that are purposeless and are repetitive continuous involuntary movements. Next. So next comes the Tandava Roga. It is taken from Sharangadhara Samhita. The symptomology include Vama Bahum Samarambhya Tada Pada Tada Angani. That it starts from the left hand and spreads to the leg and to the whole body. Next, Bibhatsa Mukhacheshita, different facial movements and expressions. And Nidrayam Kampavajitaha, loss of movements in the sleep. And Nrityanam, that is dancing type of movements. These dancing type of movements can be correlated with Huntington's chorea. That is, Huntington's chorea is an autosomal dominant hereditary disorder due to CAG repetition in Huntington's gene. Next. So here ends the symptomology. From here we'll start the treatment principles. So the first principle would be implementation of Samanya Vata Vyadhi Chikitsa. That is Sneha Sweda Tada Abhyanga Basti Sneha Virechanam. Shiro Basti Shiro Sneha Snehikam Evacha. Dumaha Snehikam Evacha. Sukoshna Sneha Gandusham Nasyam Snehikam Evacha. And the second principle would be implementation of Vata. When implementation of Chikitsa, when the Vata is situated in the Murdasthana. That is usage of Shirobasti and Shirolepa. Next is the implementation of Avarana Vatas in movement disorders. That includes Shroto Shuddhikara measures like Shilajit and Amrudu Sramshrana, Yapanavastis and Rasayanas. Next Next would be the specific treatment protocols for Kampavata. Various oils like Mahamasha Taila, Varuni Taila, etc. has been said. Charaka has explained Tarpaniya Nasya in the context of Shira Kampa. Also, Vangasena for the first time has advocated the Chikitsa principle as Vayuhu Vepadunam Shveda Abhyanga Anuvasanet Upacharet Niruhasya Shirobasti Virechnam. The importance of Niruhavasti as well as Virechna has been highlighted in this. Next one. Next is Yapanavastis. So Vastis are treated to be Ardha Chikitsa. So Yapanavastis are important because they have special properties like Sarva Kala Deya and Ubayartha Kari. It acts as both Shodhana and Brahmana. And also it has Sadhyu Balajanana and Rasayana properties. Certain Yapanavastis like Mustadi Yapanavasti, Madhutailiki Yapanavastis and Titi Baladi Yapanavasti, which has key ingredient Kapikachu. So why Kapikachu? Because it has anti-Parkinson's property and neuroprotective properties. And other vastis like Vatahara Vasti and Brahmana Vastis can also be implemented. Next one. Next, Akshepaka. Since there was no specific treatment protocol for Akshepaka, we can use Apatanika principles like usage of Achapana Sneha, Avapidana Sneha, and also Trivruta Sneha in various forms like Parisheka, Avagaha, etc. And coming to Thandava Roga, Vaishadhya Ratnavali has explained the Thandava Roga Chikitsa principle, that is Brahmanam, nourishing, Rechana, purgation, and usage of foods and treatments which increase the Agni and Bala of the patient. Next. These are the few Bahya Snehas that can be used, which are Abhyanga, like Abhyanga Patrapotali Shveda, Shashtika Shali Pinda Shveda, Kayasek, etc. And also Murtini Thailas play an important role. So these are the Murtini Thailas. But apart from Bahya Snehas, we have to correct the Amapachana, Agni Deepana and Anulomana. So Anulomana is very important in these disorders because this is the main cause for these type of disorders. The misdirected Vata has to be corrected by giving drugs like Gandhara Hastadi Thailam or Trivrit Churna, etc. Next. So these are the few Panchakarma procedures that can be used, that can be performed. So Snehapana, Abhyanga, Nasya, Anuvasana Vasti, Yapana Vasti, Smurdini Thailas. But here I want to highlight Mahamasha Thaila because Mahamasha Thaila is indicated in Pani, Pada, Shiro, Griva, Brahmana and Manda Chankramana. And also it is used in various forms, that is Chatush Prayoga, that is it can be used as Snehapana, Abhyanga, Vasti and Nasya. Next. So here is a video clip of a patient. This was conducted in Parkinson's patient. So in which we have administered 8 bindu, that is nearly 4 ml of Mahamasha Thaila in each nostril. So this was conducted in Dr. B.R. Care Government Ayurvedic Hospital, Department of Panchakarma. The patient was given Abhyanga, followed by Shveda and Nasya and Dhumapana. Next. So these are the scientific studies which are done in the field of movement disorders. So all these are the articles. These are done in specific to Parkinson's disease. Next one, please. Next one. So before concluding, I would like to say, show this case study. A 50-year-old male with involuntary movements with a duration of 2 weeks. So he was diagnosed as post-stroke dystonia. So he was managed with Shirodhara and Nasya. Shirodhara with Brahmi Thaila and and Nasya with Mahamasha Thaila for 7 days. So this is a video of the patient before and after. Can you please play it? This is after. Playing. So measures, we can correct movement disorders because we don't have any other treatment options available in the allopathy system of medicine. So we can definitely try. This will be a better alternative in the long run. Yeah, thank you.
Is Sindhu. Thank you. Now I call Dr. Yazdani to present his session.
All the delegates and the participants. I am Dr. Yazdani from Panchkarma first year PG from the department Panchkarma College, Dr. B.R.K. Ayurvedic Medical College, Hyderabad. My topic is about role of Panchkarma in disease prevention, guided by Dr. Praveen Kumar sir and Dr. B. Johar sir. Introduction. The prime objective of Ayurveda is Swasthya Rakshanam Adarasya Vikara Prashmanam. To keep healthy person healthy and to be treat a diseased person, which significantly emphasizes the preventive view of the Ayurveda. Panchkarma presents a unique approach of Ayurveda with specially designed 5 procedures of internal purification of the body through the nearest possible route. Such purification allows the biological system to return homeostasis. Panchkarma plays a full therapy role as promotive, preventive and curative procedures. And the 5-fold measures of Panchakarma are Vamana, a therapeutic emesis; Virechana, a therapeutic purgation; Asthapanavasti, a therapeutic decoctional enema; Anuvasanavasti, therapeutic oil enema; Nasyakarma is a nasal administration of medicaments. Panchakarma procedures are preceded by Snehana and Svedana procedures. Importance of Panchakarma according to Charaka Sutrasthana 15th chapter are Malapaham Rogaharam, eliminates the doshas and diseases; Balavarna Prasadanam, restores normal strength and complexion; Samyak Ayushya Ujjate Charam, brings about longevity. In Ayurveda, pathologies are interpreted as Prakopan Srota Sangadushti of the 3 doshas, which are Vata Pitta Kapha, and Panchakarma therapy acts as Samprapta Vigatana and Roga Nivarana. Advantages of Panchakarma according to Charaka Sutrasthana 16th chapter: it eliminates the vitiated doshas through alimentary tract and enhances the power of digestion and metabolism, and cures the diseases and restores the normal health, and it clears the sense faculties, mind, intelligence and complexion, gains strength, plumpness, offspring and virility. The one who should take proper elimination therapy, they are not affected by old age and live long without any diseases. Purpose of study. In the present scenario, stress, reduced metabolism, compromised immunity, chronic inflammation, hyperlipidemia are the major causes for all the majority of diseases. Panchakarma effectively treats these diseases, and also autoimmune, neurological, psychiatric, musculoskeletal diseases of chronic and metabolic origin. Panchakarma therapy majorly targets the enteric nervous system, which interconnection with central nervous system and its hormones. As many recent studies shows that presence of neurotransmitters of basal ganglia like dopamine, GABA acted on enteric nervous system and interstitial nerve cells, as these chemicals are processed by the gut bacteria. So with the right administration of Panchakarma followed by Samsajan Krama helps the both physical and mental emotional well-being, thereby making it as a holistic approach. Agni in Panchakarma. Ayurveda strongly believes that derangement of Agni digestive fire plays a major role in the cause of all diseases, which postulated as Sarve Rogapni Mandagnav, which means Mandagni is the cause for all diseases. For correction of the Agni, Panchakarma is the best treatment. As I before said, Vasti is the one of the Panchakarma, is a most pivotal of all Panchakarma therapies, and multifold action, also considered as Ardha Chikitsa. It regulates immunity by regulating cytokine proteins, treating by its Kapha Sangadushti, Samprapta Vigatana by Tikshna Guna of property of these drugs. Excess cortisol hormones, which are having Agneya in nature and which are interpreted as Pitta Dosha Prakopa, is treated by Virechana and Vasti by its Pitta Shamana action. Next. Some Panchakarmas do as a daily routines, that is Panchakarma as Dinacharya: Snehana Abhyanga, Siro Abhyanga, Pratimakshanasya, Karnapurna, Sirovachu, Udvartana, Matravasti, etc. comes under Panchakarma and can be done daily for purpose of maintaining the promoting health. In general, in a particular season, particular dosha will be aggravated. To eliminate those doshas, Vasti Karma, that is Panchakarma in Rutucharya, Vasti can be performed in Varsharutu in Vata Prakopavastha. Virechana and Raktamokshana are to be performed in Sharadrutu in Pitta Prakopavastha. Vamana to be performed in Vasantrutu in Kapha Dosha Avastha, Abhyanga Utsadana Mudinitala Jantaksveda are performed in Hemantrutu and Susaritu in Kapha accumulation Avastha. Panchakarma and Rasayan Chikitsa. Rasayan and Vajikarna are the unique classes of treatment practiced to maintain and promote the health in a healthy. These procedures are also advocated to cure certain diseases. To get this desired effect from both these procedures, it is required to cleanse the body before the administration of these procedures. Initially, the client subjected to Shodhana Panchakarma procedures. Multiplicity actions of Panchakarma. Evocation of acclimated doshas is not only the action of Panchakarma, it may also be administered as palliative and nutritive treatment by the different combinations of, in Shamanavasti, there are different combinations of decoction preparations are administered, and Pichavasti shows Tambana effect in colon, Nasikarma shows Brahmana effect, Anuvasansvasti shows anabolic effect, Shiravasti given in peptic ulcers, Yapanavasti in hemiplegia and muscular dystrophy. Global perspective of Panchakarma. Advancement in research and effort by experienced scientists develop the Panchakarma science that can be accepted worldwide. Presently, there is people shifting their healthcare from being curative to be preventive therapies. Therefore, Panchakarma gets easily acceptable worldwide. Since Ayurveda is gaining recognition at national and international market due to intense research and documentation of effective data with the involvement of enthusiastic and devoted youth, there is tremendous scope for increasing the exports of not only drugs but also manpower to provide better health services worldwide, especially in the post-reform period of liberalization and globalization. Finally, the conclusion is Panchakarma involving the all three aspects of preventive, nutritive, curative treatments methodologies due to its unique methods of drug administration and principle of biocleansing. It has distinctiveness approach of treatment. Panchakarma treatment leads to better health, is free from toxins and imbalances, and has a major role in rebuilding the body. Thank you.
Now I call Dr. Deepali Bodu to present the session.
Is characterized by pathological evidences where muscle degeneration or regeneration occurs. Diagnosis of this disorder is mainly clinical and along with the genetic testings and muscle biopsy. Dystrophinopathies are the group of disorders resulting from the mutation in the dystrophin gene. Duchenne muscular dystrophy is the most common dystrophinopathies with an incidence of 1:3,500 in male children. Mutation of the dystrophin gene causes Duchenne muscular dystrophy or Becker's muscular dystrophy. We will discuss about some DMD clinical features. Mostly DMD becomes symptomatic before the age of 5 years. The patient complains in the history we will see only the delayed walking, other milestones are achieved properly, and then gait difference is seen apparently by 3 to 4 years of the age. Mostly classical signs of DMD is waddling gait, Gower's sign and Wallis sign. The picture side by is showing the Gower's sign. Gower's sign is nothing but the child stand-ups from the sitting position by taking the support of his own body or lying on his own body. Calf muscle pseudo-hypertrophy is seen. Weakness of neck flexors is seen earlier. Other muscles such as hypertrophy include vastus lateralis, infraspinatus muscle, deltoid muscle, gluteus maximus, triceps and masseter. One more sign is seen in DMD which is called as Wallis sign. When the hypertrophy of deltoid and infraspinatus muscle is seen, posterior axillary muscle fold becomes prominent, which looks like Wallis. So the sign is Wallis sign. The progression of the weakness increases by between the 3 to 6 years of the life, followed by increasing gait difficulty, development of contracture and lumbar lordosis. Next. Weakness of this actually DMD progresses to the death. How the death is going to happen? Weakness of intercostal muscle and diaphragmatic muscles with the spinal deformity affects the respiratory function. Dropping of vital capacity less than 20% normal. leads to nocturnal hypoventilation. Cardiomyopathies and arrhythmias are the major cardiac manifestation. Children with the deletion axon of 48 to 53 are especially prone to cardiac complications. These causes death in as a combination of respiratory insufficiency and cardiac myopathy. As the picture showing side by, the children becomes symptomatic at the age of 3 to 4 years, and as their life prolongs, they become bedridden, and then death will eventually happen due to cardiac and respiratory arrest. Next. According to Ayurveda, there is no such direct correlation with any single disease, but we can correlate it with Vata doshas. Mostly Bija Dushti is seen as it comes from the mother's X chromosome, and Samprapti we can state as it is Adibal Pravritta Vyadhi, which is caused due to the Vata dosha causing Strotaroda and Manshashaya and Medmansha Stransansraya is happening over there. Strotarod produces hypertrophy in particular areas. It also manifests as the first Prakopa, then depletion of Vata element. This complex pathogenesis is responsible for the progressive wasting and necrosis of the muscle. Also, Samprapti can be sought out as Mansa Vatakshaya due to Bija dosha. My study purpose was DMD has such, as it is a genetic disorder, it doesn't have any treatment modalities in allopathy medicine, and the baby, the child in the later stage, in the first decade of his life, becomes bedridden, and the death becomes so difficult. So we just wanted in our institute, we just want to maintain the quality of life good until if we can't treat it, we just want to make the quality of life of the baby better. Next. My case was a 8 years old male child came to our OPD of GSU Osmanabad complaining of bilateral lower limb weakness and calf muscle weakness, mostly on exertion, since past 5 months. The patient was asymptomatic till history of present illness was, patient was asymptomatic till the age of 6 years. Then he came across the progressive slowness of the movement of legs, generalized pain and muscle weakness particularly. A patient was diagnosed with the raised CPK values 20,000 dated at 14th of August 2021, and gradually the patient was in the private hospital gone to genetic study which came positive for dystrophin gene mutation. Gradually patient started with these symptoms and came to our OPD. Next. Birth history. In the DMD, birth history is very important because the X chromosome having genetic mutation came from mother. But in my child, the family history was not apparently possible because mother was so illiterate. Antenatal history was normal, no any specific history is seen. Next. On examination, the baby was thin in appearance, proximal muscle weakness was seen, bilateral calf muscle hypertrophy was there, bilateral deltoid muscle hypertrophy was there, Gover's sign was positive, Wallis sign was negative, gait is partially waddling gait, muscle tone lower limbs hypertonic, muscle bulk wasting of muscles. CNX examination shows normal, conscious with time, place and person, speech was normal. General examination were normal, and investigation, they came with the investigation of serum CPK with 20,000, serum calcium, serum phosphorus, and SGPT alkaline phosphate is slightly raised, and the genetic testing called MLPA test shows the mutation of dystrophin gene. Intervention, we in our setup do the treatment in 1 settings of 1 month each, then a 15 days gap. We like this we have done 4 Panchakarma sitting with having Bahya Chikitsa like Sarvanga Snehan. We have made some a DMD formula Siddha Taila. Using this Dravya, Nimba Patola, Trifada, Mrudvika, Musta, Vatsak, Kiratatikta Amruta Chandana and Vishwabheshaja. And Sarvanga Swedan was given of Pinda Sweda with Vidarikanda Churna, and Karma Basti was planned Anuvashan Basti and Niruha Basti. Then in Abhyantar Chikitsa, Medhya Rasayan of DMD formula Dravya, which is Guduchi, Musta Chirayat, Punarnava, Patol, Chandan, Gokshur and Sariva with Yogendra Rasan, Vishutindu Vati given according to the age of the child, and Kanchanar Gugul. The result is neurological. We have assessed the baby on neurological point of view and muscle power, reflexes and muscle tone and anthropometry. Both the bilateral calf muscle hypertrophy came to slightly decreased. The CPK reports are being done eventually. Next. As you can see, muscle power was upper limb 3/5 before treatment and lower limb 4/5, and anthropometrical mostly I'll come to the point. Calf muscle circumference was 27 before treatment, which came to 24 centimeters after treatment, which was the main concern regarding calf muscle hypertrophy. Next. The DMD formula we give is works as Stabdata, Sandhistaithilya, Bruhaniya, Balyani, Amhar, and we give mostly Vata dosha chikitsa. Maunsadhara Kala, we want to work upon Maunsadhara, which is Twakadhara Kala. So we give Snehan and Pindasveda and Basti. These are the CPK values of the patient, eventually decreasing with our treatment. The child is with us from last 2 years. Next. Basti is the Adha Chikitsa. Yes. Okay.
Now I call Dr. Lijita to present this.
Everyone, myself Dr. Lisita, PG final year from Department of Dravyaguna, S.V. Ayush College, Tirupati, under the guidance of Dr. Renu Dikshit Madam. Today I am here to present my topic, that is pain management in Amavata. As everyone knows, Amavata is the most common endogenous disease which is produced due to frequently formation of ama. Due to its chronicity and complications, it has taken the foremost place among the joint diseases. And incidence it is more frequently during the 4th and 5th decades of life, and women are most commonly affected when compared to men. There is a beautiful quote in Bhagavad Gita that Aham Vaishwanaro Bhutva Praninam Deham Ashritaha Pranam Apana Samayuktaha Pachamyannam Chaturvidam. Like Agni is equal to God and it is in the form of prana in our body. So first aim is to protect the Agni by ourselves. Next. Nirukti of Amavata according to Madhav Nidana, Amena Sahita Vata Amavatam. The words Ama and Vata forms the, like this is Amavatam. Then Paribhasha, Yugapat Kupitavan Trikasandhi Praveshakau, Stabdham Cha Kurute Ghatram, Amavatam Sa Uchyate. Due to Nidhana, the vitiated ama and vata gets lodged in Trikasandhi, which leads to the Stabdha Ghatram, that is stiffness of the body parts leading to the condition Amavata. Next. This is the Samprapti of Amavata. Like Samana Vayu, Pachaka Pitta and Kledaka Kapha plays an important role in the digestion. So due to the Ahara Nidhana and Viharaja Nidhana, there will be the vitiation of all these 3 factors leading to the Mandagni. Whenever there is Mandagni, like Dhatu Poshana will not be improper. So through the Rasavaha Srotas, this the vitiated ama gets lodged in the Trikasandhi. There will be Srota Roda and Dosha Dusha Samurchana takes place and leading to the disease Amavata. This is a Samanya Amavata Lakshanam. Anghamardo Aruchit Trishna Hi Alasyam Gharavam Jwaraha Apakaha Shunata Anghanam Amavatasya Lakshanam. And these are the Pravritta Amavata Lakshanas, like when it is in Koshtashrita, the Lakshanas will be like Aruchi, Praseka, Agnimandya, Chardi and Trishna. And it is in Sarvadahika, the symptoms will be like Jwara, Ghaurava, Daha and Shula. When it is in Manasika, then patient will have that Utsaha Hani, Brahma and Nidra Viparyaya. In Sthanika Avastha, there will be Sandhiruja, Shota, Stabdhata and Vrishchikavat Dhamsha Vedana. If Amavata is because of Vata predominant, there will be like pain will be severe, and with the help of Pitta dosha is predominant, there will be like tenderness and Shota will be there. And if it is in predominance of Kapha dosha, like that particular part, they'll be feeling like heaviness of that particular part and itching will be there. Like these are the investigations what we generally do. Next slide. And these are the joint deformities which we find generally in rheumatoid arthritis condition. Next. And treatment, which we have to concentrate on Amavata, is we have to treat Amavata in 2 stages, that is Amavastha and Nirama Avastha. In Amavastha, like Langanam, Swedhanam, Katutikta drugs we have to give, so that first Deepana Pachana has to take place and later on we have to follow that Kevala Vata Chikitsya. Langanam Swedhanam Tiktam Deepanani Katuni cha Virechanam Snehapanam Vastayastya Marute Saindavad Anuvasasya Ksharavastih Prashasyate Amavate Panchakola Siddham Pana Anna Mishyate Rukshaha Svedaha Prakartavyo Valuka Putakaistatha. Next slide. Langanam, as we all know, like even in Jvara conditions, first line of treatment will be like Langana. The gunas of Langana, or their opposite to the qualities of Ama, like Lagu, Tikshna, Vishada and Ruksha and Sukshma gunas. Langana is in the form of either in the form of Upavasa or Lagu Bhojana with Deepana Pachana Dravyas are administered. And when we do fast, there will be increases of Jataragni so that we can avoid the condition like Ama. Then Svedana, generally in Panchakarma we do Svedana as Purva Karma, but in Amavata it is done as one of the Upakrama. That too with Ruksha Sveda with Valuka Potali is administered. Then like Ushnaguna, which is present in Svedana, is responsible for the dosha Vilayana, and after that dosha Vilayana, all the doshas they come and segregate in a koshta, then we can go for Virechanam. And these are the Tikta Kadu, I have mentioned some of the Tikta Kadu Deepaniya Aushadas. Why specifically Tikta Kadu? Because Katu is having Agni and Vayu Mahabhuta, and Tikta Rasa is having Prithvi and Vayu. Then these Mahabhutas, and they are having Ushna Virya, which are like opposite to the Kapha and Ama. So Tikta Kadu Deepaniya Aushadas are administered in Amavata. Some of the dravyas like Pippali, Rasona, like chemical constituents present in Rasona or allicin, allinase and alkaloids are responsible for anti-inflammatory action. And in Haridra, like curcumin present in Haridra is having anti-inflammatory, anti-arthritic and anti-rheumatic properties. Next. Kokilaksha. The higher protein content in the Kokilaksha helps to enhance the immunity and helps in anti-inflammatory action. Shunti. The chemical constituents like gingerol, dehydrozingerone and gingeroidin, they are prostaglandin inhibitors, thus it attains the anti-arthritic effect. In Guduchi, glycosides present, like they act as non-steroid anti-inflammatory drugs, like they produce anti-arthritic effect. Eranda thaila. The Sukshma guna which is present in Eranda thaila helps the drug to penetrate into the Sukshma srotas. Then Khaturasa and Ushnavirya is having Deepana and Vatahara properties. Snigdaguna is having Amapachana and Kafahara properties. And vitamin E, which is present in the castor oil, helps like anti-inflammatory and oxidant. The Gokshura is having Madhura Rasa, Guru Snigdaguna, Madhura Vipaka and Shita Virya, but it acts as Deepana Pachana Dravya. Nirgundi, like everyone knows, it is a Vatahara Dravya and it is having Tikta Katurasa Deepana Pachana, and it acts as antioxidant and anti-inflammatory. Then Virechanam. Virechanam plays an important role in Amavata. Like first we have to, in Amavata, Erandathaila is a drug of choice, and a beautiful like quote, Amavata Gajendrasya Sharira Vanacharinaha Raka Rava Nihantyashu Eranda Sneha Kesari. Like how lion kills the animals in the forest, like it is the king of the forest. In the same way, Erandathaila also plays an important role in treating the Amavata. Next slide. Snehapana. Actually, Snehapana is contraindicated in Ama Avastha, but here after treating the Ama, like Langanam, Svedhanam, and after all those things, Kevala Vata Sneha is the important factor in treating the disease. Sneha, that too Sneha with Deepana Pachana Dravyas is responsible for Vata Shamana, Agnivardhana and Kosta Shuddhi. Erandathaila should be used for the purpose of Snehapana, which also serves as Dosha Virechaka. Vasti. As we all know, Vasti is considered as Ardha Chikitsa. And it is the effective treatment in Vata Vyadhi. It normalizes the dosha, dhatu, malas and purifies the whole body. Next slide. And these are the common vastis which we give in our OP levels, like Saindavadi Anuvasana Vasti. It contains Saindava, Arkamula, Maricha, Chitrakamula, Bringaraj, Haridra and Daru Haridra acts as Deepana Pachana. Then Vaitarana Vasti, the Gomutra which is present in Vaitarana Vasti acts as, it helps in Agnimandya. Then Kshara Vasti like Saindava, Guda, Chincha, Shatahva and Go Arka. Like Kshara has properties like Lekanam and Vishoshanam. So all these vastis can be implemented in treating the disease Amavata. Next slide. Like many other vastis which I have mentioned. Then diet, as everyone was like, let food be the medicine and medicine be the food. Next slide. And some of the patyas like Yavaha Kulataha Shyamaka Khodrava Raktashalayaha Vastukam Shigru Varshabhu Karavelam Patolakam Ardrakam Taptaniram Chalashunam Takra Samskritam Jangalanam Tatha Mamsam Sa Amavatam Ghaderhitam. These are some of the drugs which can be implemented in Amavata as Patya. Next slide. Apatya, like intake of Dhadi, Matsya, Guda, Kshira and preparations of Masha, Viruddhahara, Asatmya Ahara and Vegadharana, Ratri Jagarana, Guru and Abhishyandi Ahara. Next slide. Some of the formulations like Simhanada Gugulu with combination of Eranathaila plays and best, like we have treated in our OPs. Administering Simhanada Gugulu with Eranathilam is giving a better results. Next slide. And some of the Gritas and differential diagnosis, we have to diagnose the disease whether it is Amavata or Sandhigata or Gambhira Vata Rakta. Next slide. And some of the Upadravas according to Acharyas like Sankocha, Kanjata, Kalaya, Kanjata, Angavaikalya, Akshepana and Vata Vyadhi. Conclusion, as everyone are approaching the allopathies hospitals for pain relief, like they are depending on steroids. In Ayurveda, when they proper dinacharya, ritucharya and everything, one can prevent the diseases. So like yat pinde tat brahmande, whatever is in the environment, it is also in the body, like panchabhautika or everything. So when they consume, you are what you eat, whatever the food you are consuming, it plays an important role. Thank you.
Thank you, Dr. Lijita. Now I call Dr. Sangeeta Jannu to present the session.
Good evening, myself Dr. Sangeeta, first year PG scholar from Department of Panchakarma. And topic is scientific conceptual understanding of Kavala and Gandusha. Oral hygiene is an important factor which has a significant impact on quality of life. Oral hygiene is the practice of keeping the mouth and teeth clean to prevent dental problems, most commonly dental cavities, gingivitis, periodontal diseases, and bad breath. As per the global burden of disease study, oral diseases are the most widespread non-communicable diseases affecting almost half of the world's population, 45% or 3.5 billion people worldwide over the life course from early life to old age. Gandusha is the process of holding any medicated liquid inside the mouth to its full capacity without any movement. And Kavala is defined as performing swishing movement in the mouth and then spitting out when it gets turbid. And importance of Kavala and Gandusha. Kavala and Gandusha are said to improve oral hygiene and prevent various diseases of oral cavity. A proper therapy of Kavala and Gandusha brings about alleviation of diseases, cleanses the mouth and stimulates the sense organs. Kavala and Gandusha are two therapeutic and preventive measures described in Ayurveda for oral health to be practiced as dinacharya. Hygiene of oral cavity and throat is very essential to protect the health of karna and nasa, as they are connected through eustachian tube and nasopharynx respectively. And dravyas used: Svarasa, Kvata, Grita, Taila, Gomutra, Ushnodaka, Mamsarasa, Shitakashaya, Amlodaka, Ksharodaka. And the dose of Gandusha, according to Sharangadhara, 1 kola, which is 6 grams by measure, is the dose of either a liquid or a powder. And Shrestha Matra of Kavala is half of full mouth. And Madhyama Matra of Kavala is 1/3 of full mouth. And Hina Matra of Kavala is 1/4 of full mouth. And mode of action. The drug which were administered orally get absorbed by the bloodstream and distributed all over, including the site of action through blood circulation. Mechanical pressure inside the oral cavity increased by Kavala. The medicated liquids, active ingredients, and chemical components activate the chemoreceptors and mechanoreceptors in the mouth to transmit signals to the brainstem's salivary nuclei. As a consequence, the operation of the parasympathetic nervous system increase and impulses sent to the facial and glossopharyngeal nerves. They produce a watery salivary secretions, the waste formed by metabolic activity, food debris, accumulation, and microorganisms present in the oral cavity get dislodged and mixed with residual medicated liquid and extracted from oral cavity. The medicated Gandusha balances the pH and get absorbed by increasing vascular permeability in oral mucosa. Thus, it will help to reduce the inflammation and improve the disease healing process and thereby cures oral cavity disorders. Indications of Kavala. A research was done by Dr. Praveen Kumar sir with his team in post-COVID-19 mucormycosis. They have included Triphala Daruharidra Kashaya for gargling in the prevention of progression and oral orbital neural extension of post-COVID mucormycosis, and successfully they have prevented the progression of the infection. In cases of Dantaharsha, hypersensitiveness, Dantachela, shakiness of teeth, and Mukaroga, diseases of mouth of Vata origin, gargling with warm or cold solution of Tilataila, Tilakalka, or Mamsarasa daily is beneficial. In cases of burning sensation, formation of ulcers, traumatic wound, poison, burns due to Kshara, Agnidagda, it's better to gargle with either ghee or milk, which clears accumulation of dirt and heals ulcers. Gargling with a honey relieves burning sensation and thirst. Ksharambu Gandusha. Gargling with alkaline water breaks up the accumulation of kapha. Indications of Gandusha. Gandusha with Grita in Visha, Ksharadagda, Agnidagda. Gandusha with Tilakalka with Saindavalavana in Cheladanta. Gandusha with Kanjika in Mukashosha, Asya Vairasya. Gandusha with Trifala and Madhu in Kafarakta Pitta Rogas. And contraindications. It is contraindicated in murcha, unconsciousness, shoshi, weak or emaciated, raktapitta, bleeding disorders, kupitakshi, conjunctivitis, in children less than 5 years of age, penasa, ajirna, hanugraha, aruchi, and who have received nasya karma. In ratri jagarna, in case of loss of sleep due to awakening, patient having chronic or carcinogenic ulcers in oral cavity. Next. Duration. The medicated oil has to keep in the mouth till the person develops following symptoms. Once the person develops these symptoms, he can spit out the oil. If required, the procedure may be repeated. Filling the throat by oropharyngeal secretions. And watery discharge from nose, watery of the eyes. Next. And Samyak Yoga, relief from the disease or symptoms, lightness of the body, sound sleep, normal taste, appetite, digestion capacity, and general health. Ati Yoga, it causes Shosha, Daha, Paka, Trishna. Next. Aruchi, Klama. Asam Yoga, Alasatva, aggravation of disease, Aruchi, and Kapha vitiation. Hina Yoga, Kaphotklesha, stiffness of the mouth, inability of the tongue to pursue taste. And conclusion. Kavala and Gandusha are very simple to perform and cost effective. Moreover, lipid-based medications that are administered orally have a quicker rate of absorption and have a higher drug in the bloodstream, as it avoids first-pass metabolism by the liver. Mechanical, neurological, and vascular mechanisms are there behind the efficacy of Kavala and Gandusha applications. This paper in detail discusses about the various aspects of its application with mode of action. Thank you.
Now I request our co-chair of the session, Dr. Ramu Gokarapu Garu, to conclude the session.
Good evening to everyone. So today's session, I think you enjoyed well. All the participants and all the speakers they given a nice presentation, and I congratulate each and everyone. First of all, I would like to thank Dr. Vinaya ma'am, which she has elaborated about the music therapy. Why? Because I am much more concerned about the music therapy. Why? Because you must aware about Ganapati Sachidananda Swami. So he has created various ragas I think you might be knowing about that one. And disease-wide ragas he has created, and he has implemented so many cases. So I have gone through so many cases. So with that, really it's a very good ma'am. And regarding the metabolic disorders, and you said food is a medicine. Of course, so everybody knows food is a medicine. Nowadays, the food has gone in a wrong way that, so everybody wants to eat more, and the health becomes, it is more defective. And coming to the participants, so here all the 5 participants, Sindhu, Yajbani and Deepali and Lazita and Sangeeta, all are they given their best. And the thing is here, when you came here and when you are presenting the paper, you literally you won the prize, because the greatness is that you have the courage and you have the ability to participate here, and you are inventing your views and you are inventing your topics are very good, and I congratulate each and everyone. And who are winning the paper is different thing, and everybody is a winner here. I thank one and all. Thank you. I thank Swasthya Expo who are inviting me here, and my heartfelt thanks to each and everyone. Thank you so much.
Thank you, sir. Just 2 seconds. Paper award. So, welcome, sir.
Good evening, everybody. First of all, who has informed this Swasthya program, and my heart was 16 years. I recognized in 2006 his efforts in my national seminar, who are attended 600 doctors nationwide in Warangal. So I invited him from Delhi to dedication, discipline and hard work and the innovative ideology is I attracted from him. That's why my heartfelt thanks to once again to Dr. Satyam and Snehalata. Before announcing this first prize, I would like to suggest some suggestions to paper presenters. Sorry, you are having wonderful professors and associate professors in a college and others. You do. Of course, my friend Dr. Ramu said it. Everyone is winner here who came to the dais and presented. In our times, we could not go to dais and we attended. So I am very happy regarding presenters who has prepared well slides and presentations. I am very happy to be here for your papers for this session. And prevention of Panchakarma, definitely design it and get the new reports when generally you present the cases. And also Amavata, some doctor Lijita, I think, Amavata, some Vata disorders who has presented it, I forgot it. So Ama is related to Kapha and Vata is, Amavata is both mixed disease. How can you cure it? First you have to explain it. So Pitta Prakopa is there. How it become a Vata, Amavata. So we have to think of it, and some doctors are saying, oh, it is a curable disease, Amavata. So Charaka and Suskruta, they did not tell it is a Sadhya Vata, Sadhya Roga. So it is a Kasta Sadhyam. Of course, you have to technical points, remember it when you present the paper. So because your presentation should be useful to even senior practitioners also. So that's why. So what you said, what you explained, it is well, pathology and symptoms and this, everybody knows. My professor said once I attended in final year, why you are telling pathology and clinical symptoms? So what is the specific treatment and differential diagnosis? Tell us. So they have given 50% marks to me. in Viva, in final exams. Of course, we could not ask them. I'm not blaming the professors. So that is the reason the new generations are very intelligent, and how to they complete their PG, and how to they get practice. They are very intelligent. Of course, they are doing very good practice in society. So because the paper presentation must be a new way. Here is column is the elements for new knowledge. So this is some lack is here. Please improve it. I am not blaming you. Definitely you are great. So we should listen some new elements. In each disease, one or two elements. So generally we expect it. So that's why you try for that. This is not one day practice. This is not 1 month or 2 months practice. You go on practice, and this is lifelong practice, not in PG. So you are having you are very intelligent, but I need creative intelligence, and people are need creative intelligence. So you are having creative intelligence, but you are not using that. Please use it, and I am expecting in the future. So you may get new elements in your papers. So please try it, and you are explaining the slides. Is sorrowful to us. Of course, you are trying is the best. Definitely, we should appreciate it. And without seeing slides, the slide matter should be very less. The slides should be very less. International standards, the people are saying that very less slides, less matter, more explanation. That is most important in the presentations. So my son is in working Nestle as a senior scientist. He did PhD in pharmacology. So I am learning something today also from international side. So my younger son is also, he finished MD General Medicine recently. I am learning something from allopathy, some international standards, these are all. So what they are wanting, how they are explaining, please you perceive it, international slides, how they are presenting. That is most important. Of course, this explanation is everybody knows here, even your colleagues and your teachers, everybody knows. But the slide, each slide 3 or 4 points must be there, and you must be expressed, because absorption is more. The Kavala Gandusha is also definitely, it will give very good actions. That's why she said it. That's a very good point. We should catch it, and we should interpret it in allopathy system. Otherwise, nobody will accept us. According to Ayurveda, we explain, nobody will understand that. So we should explain in integration system, then only we will get some name and fame. The system will be developed by this. So that's why I conducted one national seminar in 2006, the integration of Ayurveda and allopathy, present need of public health care. So I invited all the fraternity of medical practice doctors. That's why. So we got reputation more than 1 year. We got feedback. So everybody will understand that. Even anorectal disorders, they appreciated modern surgeons. They appreciated like anything. Oh, you are having anorectal surgery like Sarasutra. That's why I am requesting all the best in future endeavors. I hope you will become a great Ayurvedic physicians and surgeons. Okay, thank you very much. So I am going to Sindhu.
Dr. Venugopala Tota Garu sir and Dr. Ramu Gokarap sir. Now I request Dr. Ramu Gokarap Garu to accept token of love from Dr. Venugopal Garu and Dr. Vinaya Madam. Now I request chair for the session, Dr. Venugopal Tota Garu, to accept token of love from Dr. Vinaya Madam and Dr. Ramu Gokarab Garu.
It's time for our coordinator to accept token of love, Dr. Mallikarjun Elleri, founder of Elleri Piles Clinic, Lingampalli.